Hospitals have been ordered to postpone all non-emergency surgery until the end of January as the NHS is gripped by a winter crisis. Around 55,000 OPs are delayed as A&E units struggle to cope with massive demand and turn away non-urgent cases. One NHS doctor at Royal Stoke University Hospital, Dr. Richard Fawcett, even personally apologised for third world conditions. Health Secretary Jeremy Hunt was today accused of fleeing the scene as he failed to hit the airwaves to reassure the public. And Tory MP Sarah Wollaston, a GP and chair of the powerful Commons Health Committee, warned Theresa May must get a better grip. In a drastic step to try to free up hospital staff and beds, NHS England also said the deferral of non-urgent inpatient elective care, such as hip replacements, should be extended until January 31. Cancer operations and time-critical procedures should go ahead as planned. The pressure has also forced chiefs to lift a ban on mixed-sex wards despite Mr. Hunt vowing to get rid of them. Labour accused Mr. Hunt of doing a grayling, after the Health Secretary, like his Transport counterpart Chris Grayling, was unavailable for interviews on a day when his department came under scrutiny. Professor Keith Willett, Director of Acute Care at NHS England, insisted the delays were part of a well-planned system. Professor Willett added, "As an emergency surgeon I have seen difficulties like this in the past." But Labour's Shadow Health Secretary Jonathan Ashworth blamed Tory underfunding and said, "Ministers must get a grip of this escalating crisis." Shadow Health Minister Justin Matters said Mr. Hunt was going to ground and refusing to explain the appalling downturn in standards of care this winter. Have you had an operation delayed? Share your story by emailing webpolitics@trinitimur.com. He added, instead of running scared, Jeremy Hunt must answer for his party's sustained underfunding of our NHS, which has already caused such misery right across the country. After 5 years in the job he should be taking responsibility, not fleeing the scene. Tory MP and health watchdog chief Sarah Wollaston said the Prime Minister and Chancellor Philip Hammond need to get a better grip. She told BBC Radio 4's Today programme, "You have a very major increase of people who are living longer with complex conditions. That produces particular demands on the health system that I think they need to get a better grip on to understand the sheer scale of the increase of demand across health and social care. That's what they need to do better planning for. And there are many people prepared to come together with goodwill across political parties to help achieve that." Ms. Wollaston added there were serious issues with capacity, not enough money gone in over the years, and the UK public are going to have to pay more. At least 21 trusts issued social media alerts yesterday people to stay away from extremely busy A&E units except in emergencies. Those who turn up will be assessed by a consultant on the door to establish quickly whether they are seriously ill. Anyone with a minor illness or injury may be told to go to a walk-in centre, a GP or pharmacist. The Health Service's National Emergency and Shy Pressures Panel originally advised hospitals to postpone non-urgent OPs and inpatient and shy treatments until mid-January. But NHS Medical Director Sir Bruce Keogh said pressures from the Christmas and New Year period were expected to continue, and there were also early signs of increased flu prevalence. He added, "The NHS needs to take further action to increase capacity and minimize disruptive last-minute cancellations." It is the second order from the panel set up after last year's NHS winter crisis, which saw the Red Cross deem it a humanitarian emergency. Saffron Cordery, Director of Policy at NHS Providers, said, "It is good to see the National Emergency Pressures Panel recognises the scale of the pressures trusts face. Many are dealing with unprecedented demand, reflecting the recent rise in cases of flu and respiratory illness, the impact of norovirus, and in some places primary care including GPs working at more than full stretch. The response outlined in these recommendations is sensible and proportionate." Emergency medicine consultant Dr. Adrian Boyle said, "Everybody is struggling at the moment. Every Type 1 emergency department that I know of is under serious and sustained pressure. Nick Scrivine, president of the Society for Acute Medicine, added, "The position at the moment is as bad as I've ever known.